Coast.
Question number 7, Kevin Hague. Order.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks exactly how many of the 21 recommendations to the Minister in the 2010 Public Health Advisory Committee report, The Best Start in Life, Achieving Effective Action on Child Health and Wellbeing, has he implemented?
Honourable Tony Ryall.
19.
Supplementary.
Order. Order. Supplementary question, Kevin Hague. Order. I have called Kevin Hague.
Why, over the last 2 years, has the Minister actually chosen to ignore the vast bulk of the recommendations in the report, including speed up the implementation of the Child Health Information Strategy, require DHBs to develop child health implementation plans with measurable outcomes and accountabilities, develop a set of cross-agency policies that reflect cross-party agreement on child health and wellbeing, outline the specific actions and accountabilities of each relevant government agency, require all significant government policies to be assessed for their potential impact on children, assess access and quality.
Order. I've got to ask the member to bring this question to a conclusion.
Well, point of order, Mr. Speaker.
Point of order.
The Minister, in his response to the primary question, indicated that with no further detail, that he'd implemented 19 of the recommendations. I cannot properly challenge that without listing the very many recommendations where clearly there has been no action.
I don't accept that for 1 minute. That because the member disagrees with the answer that was given by the Minister, that's debatable, but he doesn't then need to breach standing orders with the delivery of a supplementary question.
Mr. Speaker.
Point of order, Kevin Hague.
In the last question being considered by this House, Minister Joyce, on several occasions, gave answers that lasted several minutes. Now, this question is not taking anything like that amount.
Order. I don't need any assistance from the Leader of the House. There were some answers by the in the last question by the current Minister that were long, and I stood when I felt that they'd gone on for too long and told him that the answers were to cease. I can take a very similar approach now to the member if he likes and conclude his question and let the Minister answer, if that's what the member would like, or I'll give him a very brief chance to bring that question to a conclusion.
Well, the very last point that I wanted to include in this one, then, Mr. Speaker, is assess access and quality of healthcare and disability support services, all of which strongly emphasise a public health approach to child health.
Honourable Tony Ryall.
Mr. Speaker, the government has seriously considered this report, and we have effectively implemented 19 of the recommendations in our view. And what the member listed were a number of the things that this government has taken in a cross-government agency collaborative way, involving the Honourable Paula Bennett, the Honourable Judith Collins, the Honourable Hekia Parata, the Honourable Anne Tolley, Honourable Joe Goodhue. A large number of ministers have worked effectively together. And in fact, our government has made this such a priority that our record is actually unparalleled compared to many other parties in this parliament.
Supplementary, Mr.
Supplementary question, Kevin Hague.
For the last 2 years, has the Minister ignored recommendations to develop, monitor and report upon universally agreed high-level indicators for child health and wellbeing, because he knows indicators would actually show his government is failing the children of New Zealand?
Honourable Tony Ryall.
Mr. Speaker, no. I draw the member to a number of reports that the government has which have regular reporting, including the national health targets, the Prime Minister's key result areas, the new quality improvement framework for the well child, and I'd also draw the member's attention to the latest immunisation statistics, which show for 2-year-olds in 12 of our nation's 20 district health boards, the Maori immunisation rate is either greater or equal to the Pākehā immunisation rate. That member and his colleagues spent 9 years trying to close the gaps, and we are doing it.
Supplementary.
Order. Supplementary question, Kevin Hague.
Oh, I don't remember those 9 years. I must.
Order. Order.
Supplementary. Then
Order.
Then why?
Order. I'm on my feet. Would the member please assist the order of the House by just asking his supplementary question?
Thank you, Mr. Speaker. Why is the Minister providing no leadership to develop the recommended cross-party agreement on child health and wellbeing policy as recommended by the report, but instead pushing an increasingly political agenda of ill-conceived, narrow targets that ignore the public health approach?
Honourable Tony
Mr.
Ryall.
Speaker, the government's pursuing a number of initiatives for children that enjoy the support of all parties in this House. I've not heard any parties criticise the work we're doing in immunisation. I've not heard any parties criticise the leading work we're doing in rheumatic fever that was ignored by the previous government. I've not heard any parties criticise the work we're doing with the Children's Action Plan. I've not heard any party opposite criticise our extra investment in Plunket. I've not heard any party opposite criticise a 24-hour Plunket line other than the Labour Party.
Supplementary question, Kevin Hague.
Thank you, Mr. Speaker. Has the Minister not implemented the report's recommendation to set measurable objectives to reduce the number of children living in serious hardship because he agrees with the Minister of Social Development, who says there is no official measure of child poverty?
Honourable Tony Ryall.
Mr. Speaker, I draw that member to the Prime Minister's key result areas, which are specifically targeted at making sure we help vulnerable children in New Zealand. You see, the difference between this party and that member's party is that we're actually committed to action instead of carping from the sidelines.
Supplementary, Mr. Speaker.
Supplementary question, Kevin Hague.
Is the Minister so opposed to the recommended public health approach to addressing our poor child health status that he no longer sees the need of the Public Health Advisory Committee that made these recommendations, which was established under the statute, but whose last meeting under his watch was in 2011?
Honourable Tony Ryall.
No, Mr. Speaker, our government's taking a very strong public health approach to improving the health and wellbeing of New Zealand children. In fact, I can just recite the hundreds of millions of dollars that have been spent on the home insulation program, where far more children are now in warmer homes subsidised by this government than what was ever achieved under the paltry little scheme of the paltry little Green Party. And I'd also look, for example, at the immunisation, the rheumatic fever and the Prime Minister's key result areas. We've achieved an awful lot.
Point of order.
Order. I have a point of order. Kevin Hague.
This point of order is not about the gratuitous insult, but it is about the fact that my question was actually about the Public Health Advisory Committee established under statute, which has not met since 2011.
Order. If the member goes back and examines his question, there was about 3 legs to that particular question. The Honourable Minister's... no, I disagree with the member. Question number 8, Jackie Dean.
Thank you, Mr. Speaker. My question